Dementia is a cluster of symptoms. And these are symptoms which include memory loss, the thing that people are very familiar with. But my friends with dementia tell me that memory loss isn't the worst part of the dementia syndrome, because many of us already suffer from memory loss. I'm not very good at remembering things, but I make notes and I work things out. You know, I couldn't remember my way here today, but I worked it out. The problem for a person with dementia is that they can't work anything out. So when they forget something, they're completely stuck. And you know what it's like if you've completely forgotten something and you've got no way of working it out. It gives an incredible feeling of stress, and stress makes people behave in strange ways. The sort of behaviour that people used to call disturbing or disturbed behaviour is actually stress behaviour or distress behaviour. The really important thing for people to know is there any evidence at all about what it is that makes a difference in dementia? Now, most of the things which will help you stay well with dementia are things that there isn't a huge amount of research evidence for, and that's mainly because it's very, very hard to get any money for research that demonstrates the benefits of those things. But it's really hard for me to get money to prove one of the things that I accept as an absolute fact about dementia, which is that simply increasing the light level in the room makes more difference in many cases than the drugs do. So if you've got something as cheap as that and as simple as that, it would be really great if somebody would pay for me to examine that research, but that's not as sexy as inventing a drug that's going to make a difference. Hydration can make a huge difference in dementia. My colleague Mark Butler and I recently did a report on the care in hospitals, some hospitals in Wales, and we found people in hospital who were very, very dry at that time. The situation's been resolved. But dehydration can really reduce cognitive function in people with dementia, and yet in hospital people weren't being given enough to drink. Dementia is a phenomenal economic and financial problem for all developed countries. And I remember when the Westminster government announced its dementia strategy, which had been partly created by Professor Shubhi Banerjee, I remember Shubhi saying, you know, it's really not very clever, because what's happened is we've now got a government that's right behind a dementia strategy just at the time when we're having a total economic crisis.
So how would you approach reducing fear of dementia in the population?
I've not had the experience of being diagnosed with dementia, but in talking to people with dementia about what happens at that time, they say it's absolutely devastating. It's really awful when you're diagnosed, because it is a fatal illness. So being diagnosed with a fatal illness is always a terrible experience for whoever's going through that. And it means that people have got to start thinking about death and dying in a way that we probably don't talk about a lot in our society. In addition to that, the media images that we get of dementia are, you know, care home catastrophes or bad things happening in hospitals. And so you were right to be afraid and think, is something like that going to happen to me? And I think that the best way of quelling that fear is giving people the information that they need that demonstrates how they can avoid the worst of those experiences. The earlier you're diagnosed, the better, because if I was diagnosed today, because I know my cognitive function is reasonably good today, I know that I've probably got 10 or 15 years during which I could, depending on what kind of dementia it is, cause of dementia is, during which I can sort things out. So, you know, at the age of 50, get yourself a power of attorney organised so that you know some of those horrible things about loss of power won't affect you, because you've already set somebody in place who will make decisions for you. So having the knowledge about how you can protect yourself is a really good start. I wish I could police the media, only in this respect. I think the media should be as free as possible. I wish they would stop saying sufferer, and I wish they would stop having miracle cures, because it always turns out to be nonsense and it completely debases the discussion. The discussion should be about the fact that in a world where people are going to get dementia for the foreseeable future, is there any light in the tunnel in terms of a cure or prevention or symptom control that is coming down? And that's not something that's helped by these, you know, headlines that give false information. In Singapore, there is actually a law that's been there for 10 years that means that you get fined or go to jail if you don't support your parents. I wouldn't go as far as saying that a law should be made. But why did they make a law like that? It was because they knew as a government they would not have the resources to be able to manage the ageing population without a citizen contribution. Now, if we're going to reach the stage in the UK where that is the economic position, at what stage are we going to start explaining that to the public? And it might be that politicians say, oh, it's too soon to explain to the public that the NHS cannot do this kind of care for you, or that social services cannot do this kind of care. So we just limp along, and every now and again there's a scandal, and it turns out to be the fault of the person who was there on the day, as opposed to being a whole system thing. We all need to be engaged in this conversation.